Ultimately, what we want to be able to do is give girls voice, choice, and agency.
From Women Delivered. One of the buzzwords of this conference is something incredibly important, is to get to stronger health systems, to better serve women, to better serve adolescents and girls, young people in general. I'm going to talk about that in Ethiopia specifically, and a little bit about programs around the world run by PSI to support governments and other institutions to get to stronger health systems. You work in the Health System Accelerator program. Could you tell us how some of these immense challenges can be tackled?
Ultimately, what we want to be able to do is make sure that young people have the information at their fingertips to be able to navigate through sometimes a very muddled system and make the best choice for them. At PSI, one of the things that we realize is that a young woman's journey is very complicated. So we are really trying to make sure that we work with communities, we work with adolescents, we work with stakeholders and governments to try and see how we can work through existing mixed systems to basically promote consumer-powered healthcare. So being able to give girls voice, choice, and agency. For example, they want to seek services, we provide them information, make sure that they have all the tools at their fingertips using approaches that work best for them.
Could you talk a little bit about prevention, for instance, vaccination, HPV vaccination for adolescents? With HPV vaccination, we hear around the world that it's often the case that young people don't know about it. How would a young girl of 12, 13 know?
Young people are early engaged in sexual practice. They are engaged in marriage. And because of that, cervical cancer is the second leading cause of cancer among women of reproductive age. As part of prevention, HPV vaccine is now recommended for young girls before they start to have sexual practices. Cervical cancer and its prevention is broadcast through TV and radio. Most of the young girls are found in school.
What about self-care?
Part of being able to give young girls and women the agency that they need to be able to make their choices is to provide products and services as close as possible to them. So whether it's community, whether it's at a facility level, or if it's actually a product that they can self-administer. From a prevention perspective, information is key, and especially for young girls who may not be able to make decisions, we also need to then empower the communities, their mothers, the gatekeepers in those communities to realize the importance of getting vaccinations, of at the level of care of making sure that we can integrate as many services as possible so we can make it much more easier for young women and girls to be able to access those services.